An inconclusive scan is where an intrauterine pregnancy can be confirmed but viability cannot be. There will be a gestation sac and a yolk sac, or maybe also an embryo of less than 7 millimeters with no fetal heart. The sonographer must describe the inconclusive scan to ensure the woman understands the possible outcomes. When the sonographer sees there is no heartbeat, then they must measure the embryo and the gestation sac. If no embryo and just a yolk sac, just measure the gestation sac. The measurement of the embryo is a nice guideline. The measurement of the gestation sac is a window to the womb guideline. If the gestation sac is less than 25 millimeters, then a rescan in 2 weeks is recommended either at the clinic or she can see her GP. If the gestation sac is more than 25 millimeters, then a referral to the early pregnancy unit must be made. The sonographer must explain that they are sorry they cannot be conclusive at this scan. They must then explain they can see the pregnancy sac with a yolk sac, which confirms an intrauterine pregnancy. However, they cannot see a baby, or they can see a baby and tell them the measurements, but unfortunately no heartbeat. There are 2 possibilities for this inconclusive scan. The first is they are too early, although it must be remembered that women at the clinic should be 6 weeks pregnant with a positive test 2 weeks before this scan. The other possibility is that there is a problem with the developing pregnancy. They should then explain she will need another scan in 2 weeks in order to be conclusive. The report should be on template A, and the template booklet in the clinics advises of the alterations that are necessary, and should feature the gestation sac measurement and, if appropriate, the CRL measurement. When the CRL measurements gives a gestational age of OOR, this is out of range, the sonographer should explain that the baby measures just under 6 weeks. The conclusion must be inconclusive scan, rescan 2 weeks, or refer early pregnancy unit. The woman must be given the information leaflet for inconclusive scan so that she has something to read when she gets home.